Hi, everyone. Good afternoon. I'm Elliot Vernet. I'm now serving as a president of the General Council of Biomedical Engineers for Latin America, known as CORAL. I'm also a member of SOMIB, the Mexican Society of Biomedical Engineers, and I work for my own company called 310Med. Last year, we tried to develop a pilot program for the promotion of biomedical engineer or clinical engineer in this case, in the public service in the state of Sonora. The state of Sonora is in the northwest of Mexico. The teamwork, the people who work for this, there were many people, but the main work was the professor Mariana Tarin Leon. She is a member of the Mexican Society. The student who was helping us was the Fatima Carolina Solis from the Technological Institute of Hermosillo. The engineer Raul Armando Andrade from the Mexican Society of Biomedical Engineers, and myself, Elliot Vernet, for the SOMIB and the company 310Med. What is the background around this project? The state of Sonora, there are 3 universities that is offering the degree of biomedical engineer. So we expect an average of admission about 260 students per year. This is a number that there is the admission, so we are expecting to be graduate about that number. In other hand, the public health service in the state of Sonora are divided into 5 jurisdictions, whose purpose is to plan, coordinate, supervise, and evaluate the provision of the medical care service for the population. We are talking about 2.5 million people. They have the responsibility and the public health for the entire state population. So the project was delimited, selecting only one of these 5 jurisdictions in the center of the state, or the capital of the state, called Hermosillo. Where the justification for this project was this work is motivated in order to be a promoter with the state government authorities. So this graduate of biomedical engineers from the state of Sonora may join in one time to the public health service. And for other hands, the purpose of this work is to exhibit to this personnel, so the directors and personal administrative of the health service, the role played by a biomedical engineers in the clinical hospital environment, showing the importance of the management of medical technology and how it is impacting on the quality of health care service. The description of this project is, what we did is, before defining a strategy for the promotion of biomedical engineer in this public institution, we made a survey and applied it to the chief administrative department, as well as other personnel involved with medical technology, as medicals, nurse, and paramedical positions. The data obtained through the survey gave us a general overview of the knowledge that the staff of the institution was regarding about biomedical engineer issues. This result defined first topics for the lecture of training. This is the topics that we defined after the survive: electrical safety, metrology, technovigilance, clinical engineer, and the importance with the hospital environment, functional inventory, the importance of preventive maintenance, use, handling, prevention of handling the monitor signs, and dental units. After defining these 8 topics, it was developed a schedule of talk or a program to the personnel of this public institution. We work on only considering only administrative, medical, and paramedical position. This is very important that our presentation, our program is not done for biomedical engineer. It's not intended to talk to biomedical engineers. So the SOMIP, the person who worked for this project was the professional chapter of SOMIP and the company 310 Med. They developed the topics and the oral presentations. The goal of the project and the final user that will benefit. So in order to spread the activities of biomedical engineers, a series of lectures was carried out for health personnel from the health jurisdiction #1. The lectures were given by professionals belonging to the Mexican Society of Biomedical Engineers. The development of this work is motivated in order to be a promoter with state government authority, so that the graduate of this career the career of biomedical engineer in the state of Sonora can be incorporated into public health service. The result that we have, we did 8 lectures on biomedical engineer, were designed for decision makers and medical staff, not doctors, nurses, and medical staff, administrative staff. For reason of the COVID-19, we only have time to have 5 talks for an average of attendees of 40 people. The importance of the role of clinical biomedical engineer in the hospital environment was recognized with the incorporation of 2 students practicing biomedical engineers. What we expect as a future perspective to consolidate a program to promote the biomedical or the clinical engineer in the health service that can be replicated in other healthcare centers of the state or as well as a national level. This is what we have. Thank you very much for your attention. I'm Elliot Vernet. This is my email address, vernetelliot@gmail.com. Thank you very much. Good afternoon.